A lot of women fear testosterone therapy because they heard from their neighbors and or some relative or their friends that, oh, you can't use testosterone because it's going to give you, hair on your face. Well, I hate to break, the news, but as soon as you go into menopause and you lose estrogen, you lose the capability of suppressing hair growth on the face. And therefore, women are around, as my mother has for 50 years now, has been plucking hair off her chin because she's menopausal. So any woman who goes into menopause can get and probably will get facial hair of one type or another. If someone doesn't know what they're doing with testosterone, then you can, create an abnormal testosterone environment, which may lead to some increased facial hair growth, but it probably was going to be there anyway. It just may have accelerated the growth. But there are things that you can do to stop that from happening, and it doesn't necessarily involve medication. It can involve some, herbal agents that block that from happening, and we in fact had those kind of herbal agents in our practice, that I developed personally, so that it promotes hair growth it promotes normal hair growth on your head, or sustains normal hair growth on your head, but depresses the possibility of getting facial hair or hair on your chest or back, and even suppresses the possibility of developing acne. So there are things that can be done, and the fear of using testosterone for us is not there, because we have a wide safety margin in what we do, and we individualize the dose to each individual person. And you can't give a woman who weighs 180 pounds, and by the way, a woman who weighs that much is more prone to developing hair on her face and body compared to a woman who's 110 pounds. Because unfortunately, fatty tissue produces hormones that are testosterone precursors that cause facial hair and acne because of the development of insulin resistance, which the more fat you carry, the more insulin resistance you have, the more hair you get on your face, and the more hair you lose on your head. So if you see a lot of older obese women, you'll see their hair is thinning, they're having problems with facial hair, and they may have some acne, breakouts. So testosterone, just like any other hormone, used properly, does not result in hair growth in areas that you don't want it.